Okay, good morning, everyone. My name is Sinenhlanhla Chimo. I am the Senior Manager for Communications here at the NICD. And today, the NICD, along with the South African COVID-19 Modeling Consortium, have developed a dashboard to assist the public to understand COVID-19 risks and to make informed decisions. So we've got a team from the South African COVID-19 Modeling Consortium to take us through some of the objectives and present the dashboards to the media colleagues. So without wasting any time, I would like to introduce Dr. Meyer, Dr. Jacine Meyer, who will take you through some of the experts that we have today. At the end of the session, we're going to have a Q&A. So I'd appreciate it if colleagues can hold their questions towards the end, but also you can direct questions to me on the chat group, and I'll make sure that you get the responses. If not on the session, I will email them later to you. If you do have pressing questions, please feel free to make use of the chat room and direct the questions directly to myself. Thank you so much. Dr. Meyer, over to you.
Thank you very much, Sina. Welcome, everybody. We are very grateful for your attendance. We feel it is a bit of a hard task for us to basically follow the president's address yesterday evening, which we know is commanding the newsrooms around the country. Hard act to follow. We'll do our best. My name is Gesine Meyer-Rath. I'm an associate professor at WITS as well as Boston University. And I'll just start this presentation very much on behalf of the team at the South African COVID-19 Modeling Consortium. We're talking about our new dashboard, the SACMC Epidemic Explorer, which allows us to track COVID cases and exploring risk at the district level. You might have heard of us over the last couple of months, even though admittedly not so much over the last 3 months. We were established very much in the end of March by request by the Department of Health. We develop our models very much jointly. The work is led by Dr. Sheetal Silal at the Modeling and Simulation Hub Africa at the University of Cape Town, together with Professor Juliet Pulliam from CECIMA at the University of Stellenbosch, and then me and my two colleagues, Brooke Nichols and Lisa Jameson from HERO at WITS, as well as Dr. Harry Moultrie from the National Institute for Communicable Diseases. And we have additional economic analysis that's done by Dr. Idioma Edoka from Priceless, also at WITS. Our work so far has consisted of developing two main models and updating them extremely regularly. That's the National COVID-19 EPI model and the National COVID-19 cost model. We've received ongoing input from a whole number of people through the modeling consortium, including clinicians, virologists, epidemiologists. We've updated our projections very regularly between March and September, almost weekly at the surge or at the duration of the first wave, and shared them with especially the National Department of Health, provincial departments of health, Treasury, and other partners. We have, however, not been as able to share these updates with the public. Our last update was from September. All of those main reports are available on the NICD website. We have, when it comes to the resurgence or the second wave, we have not been able to put out long-term projections incorporating that as yet. And that is because we require additional data on this. We need to know what the exposure has been of people across the country at district level. So essentially data on the SARS-CoV-2 zero prevalence. We also need to know or have a way of approximating changes in adherence to non-pharmaceutical interventions. And we need better data on contact pattern behavior in particular. We are very much working on adding this data, analyzing this data, and incorporating it into a new model that allows us to forward project. We are also working alongside the Ministerial Advisory Committee on Vaccines to model vaccine priority populations and the budget needed for different vaccine options over the next couple of years for South Africa. In the meantime, however, we have very much focused our attention on looking for signals that allow us to to trace and track, but especially also predict small-scale resurgences at the district level. You've heard in the last week that South Africa, that the Minister of Health mentioned that South Africa is now in a second wave. Now, what does that mean, and what is the definition that applied there? The criterion that the minister used was defined by the Ministerial Advisory Committee on COVID in the beginning of November. And the definition there was that a second wave is when the 7-day average number of cases increases to 30% of the peak of the first wave. Now, the peak of the first wave was round about the 18th of July, at which stage we had 12,280 cases. The threshold since then has been defined as 30% of that, or 3,680 cases. And that threshold was breached for the first time on the 5th of December, when we had 3,863 new cases. So again, this is the 7-day average. And at that stage, we informed the Minister of Health and the Ministerial Advisory Committee on COVID, and that information was broadcast more widely. Now, the 30% is a definition that is not ours necessarily, but was based on analysis to which we contributed. And my colleague, Professor Pulliam, will take you through that analysis in a minute. So that was exactly when that threshold was breached. And as you can see, the cases have, as they do, since increased quite a lot. So the latest case data that we have from the 13th of December, there the 7-day average was 6,845 new cases. The reasons for the second wave that we see at the national level is a number of provinces having gone into the same type of scenario, so a second wave consecutively. We all have heard over the Eastern Cape, which basically breached that threshold towards the end of September. Western Cape followed suit, but KwaZulu-Natal has also breached that threshold in the last couple of days. And the most recent data that is not included in this graph, but has been, that we analyzed essentially overnight, shows that Gauteng now officially is in a second wave as well, so has breached that threshold. So it's essentially 4 provinces altogether that have gone over that threshold, which means we no longer need a localized response. As a country, we need to do things differently. Why is calling a second wave important? Is this altogether just an academic exercise? Is it something that people think up staring at data all day long in front of their computers? Or has it actual implications? We think the implications are twofold, and this is why we have fought long and hard to make this data public and make it available to both planners but also the public. The health system needs to prepare for an additional surge in cases and hospitalizations. We know we have very low capacity. We also know that our possibility of extending this capacity is somewhat limited, but that means we still have to have data, good enough data and data early enough to see what we can do with pushing that envelope a little bit further. For that, early detection metrics for resurgence are required, and the focus here is on early. Both good signals, but signals that we can read early enough. We also believe, as a consortium, very, very strongly that the public needs this data to make decisions, especially at this time of the year, especially today, tomorrow, in the next couple of days, about travel and risk. We do not, as a consortium, consider or recommend that anyone changes travel plans. If they can, that is entirely up to them. But what is really important is that as people travel, they are aware of the risk level that exists at the point that they are going to. And for this, we believe people need to consider both the cases and the development in cases at their destination, but also the current hospital occupancy at their destination. And where possible, make decisions and perhaps change decisions and change routes based on that. This is why we have developed a dashboard that we call the SACMC Epidemic Explorer. And my colleague, Dr. Sidal, will take us through that in much detail later. I'm handing over to Professor Pulliam now.
Thank you, Sina. Good morning, colleagues. My internet connection is actually dropping regularly, and I think that Dr. Sheetal Siwal is going to do this section just to ensure that everyone can hear it and that I don't get interrupted. Thank you, Sheetal.
Thanks so much, Professor Pulim, and I'm so sorry about the internet connection. So we want to talk a little bit on the introduction to the resurgence metrics, the particular metrics that we display on the dashboard. Thank you. For the next slide, please, Gazina. So there are three metrics that are displayed on the dashboard. Metric called case threshold metric, sustained increase monitoring, and a metric on hospital admissions data. So first, let's talk a little bit about the case threshold metric. This particular metric is focused on measuring the current COVID-19 risk in a province or a district. And this particular metric is where we measure the total number of cases per week. So our daily cases summed up over a week per 100,000 population in an area, that is a province or a district. And we have, in this case, chosen this particular metric so that it will allow enough of a lead time or enough of a preparation time to enable a health system response for the Department of Health and planners and businesses and so forth, but also for the public in order to anticipate areas that may become of high risk or plan adequately if travel to an area is going to be taking place in the next few weeks. So this particular metric, as we measure cases per week per 100,000 population, is classified into three states. We have a low risk state, medium risk, and high risk state. We've also simultaneously defined this low, medium, and high risk according to another set of terms: control, alert, and response, in order to assist planners in the management of COVID-19 risk in the coming weeks, where a low risk corresponds to a mode of control, a medium risk to being on alert, and a high risk to active or a definitive response. And the low risk criteria is where we have less than 10 cases per week per 100,000 population, medium risk between 10 and 30 per week, and when we say per week as well, just to clarify, we don't mean Sunday to Saturday, we mean in the last 7 days. And then the high risk corresponding to more than 30 cases in the last 7 days per 100,000 population in an area. Thanks, Gazina. And so what that results is us being able to provide heat maps or plots like this. Here we're looking at the Eastern Cape as a province and districts within the Eastern Cape. And we can see over the last 60 days or 2 months, we can see that from the 12th of October, the status, according to this metric, in each of the districts in the Eastern Cape has been changing over time. From the 12th of October, districts like Sarah Baartman had been on the response level from the 12th of October onwards, whereas Alfred and Zo and OR Tambo were in the control phase, but at around the 3rd week or so of November, moved into the alert phase. Now, this helps you to see for how long has an area been in alert control response, or what we might call low, medium, or high risk. Thanks, Gazina. And then it is equally, or perhaps even more informative, to view this in a district map, where we can see that we might be living in one area of the country, but how does the country as a whole look in terms of the distribution of COVID-19 risk according to this particular risk metric? It's also important to point out that there are many metrics, the next slide's fine, thanks Gazina, that there are many metrics that we can use in order to measure risk in an area. We've chosen a few out of a subset of many in order to display on the dashboard. So the second set of metrics that we are displaying is called sustained increased monitoring. And here we're trying to, what these metrics are trying to achieve is how to display the increase in cases over time. So it highlights periods of sustained or continuous consecutive increases in case numbers. And this helps us to define stages of the epidemic in a province or district over time. And it is with this particular set of metrics that we defined when the first wave had ended and a criteria for the second wave and so on. Thanks, Kazina. And so we have here the map of South Africa. Now the shape of the, on the black line, which one would think are cases, looks a little different to what we're used to seeing. And that is because the y-axis is plotted on the log scale. And so we have incidence that is plotted on the log scale. And so the shape will be different. Now, if you look at the colors here, we have blue, yellow, orange, and red. Now, these criteria, which are explained in detail in the app, refer to, in the blue case, post-wave. So when it is declared the end of a particular wave and the period that follows thereafter. And when we have the yellow and the orange upswing and sustained increase, these refer to periods when there are increases that happen either consecutively over a period of 5 days, which is how we define our upticks. You can see that from the triangles at the top of the line. It looks a little small in the presentation, but perhaps, Gazina, with your cursor, if it's visible, we can highlight where the triangles are. The orange segment of this particular, or in this curve, represents sustained increase, so where we are seeing in a period of 8 days, at least 6 days where the moving average of cases has increased compared to the previous day. And then you see the red, which is the declaration of a new wave. And in this, at this point, this is how we with the red dashed line, we surpassed or exceeded the threshold for a new wave and declared on the 5th of December that South Africa was in a second wave as a country. Now, of course, can we move to the next slide, please, Gazina? We can now apply the same set of metrics to provinces as we have done here. And we can see now with respect to the new wave that the Eastern Cape and the Western Cape have been defined as being in a second wave for a few weeks now. And in the last week or in the last few days, KwaZulu-Natal as a province has also exceeded the threshold to be declared in a second wave or in a new wave. Thanks, Gazina. The third metric that we show, or type of data that we display in the dashboard, is called hospital admissions data. And here we monitor hospitalizations at the provincial level, both in terms of new admissions on a daily basis, as well as current occupancy. Thanks, Gazina. Here we see a plot of the Eastern Cape, where we have daily admissions on the left-hand side, and on the right-hand side we have current occupancy, or what we might term beds in use, noting of course that these two plots are for COVID-19 patients only, so daily admissions for COVID-19 and current occupancy for COVID-19 patients. Thanks, Kazina. And so we come to the dashboard demonstration. Next slide, please, Gazina. The dashboard is available at this URL, www.sacmcepidemicexplorer.co.za, noting, of course, that the URL is absolutely available in non-caps or lowercase only, but we're just showing the caps here in order to make it easier for the public to remember. The SACMC, South African COVID-19 Modeling Consortium, epidemicexplorer.coza. And what you're seeing is a landing page of the dashboard. At this point, if you allow me a minute or so, I'm just going to share my screen and demonstrate the dashboard live. Thank you. Okay, I do believe that you are able to see my screen now. Is that correct?
Yes.
Yes, perfect. Thank you. Okay, so you are seeing in my browser, the SA Epidemic Explorer.co.za. Here is our landing page. I'm going to come on to the particulars on use of the dashboard and technical details at the end of the demonstration. For now, let's get straight into how to access the data. So we click on the top here at the Resurgence Analysis tab, and what we have as the very first tab here is About. You notice two things. We have a sidebar here with location selection. This allows us, it's currently set the default on all South Africa, but allows you to move between the provinces. Let's leave it on all South Africa for now. We have an About page here, and this is particularly important. It tells you how to use the dashboard. What do we show? Here's a description, a short description of the metrics. What data is on the dashboard? And we highlight that this data in particular comes from the National Institute for Communicable Diseases. And with details on the case data. I just like to double check. Are you able to see my screen? I'm getting messages that some cannot. Before we move further.
So we can see it.
Okay, thank you. So we have we have some details here on the case data and on hospitalization data. Also, two notes that are important, that with respect to accessibility, the colors on the dashboard and the report have been chosen to be accessible to people who are colorblind with the following types of color blindness. And we have some details on the license, which we will go into in more detail in a second. So if you go to the next tab, we have here the cases threshold metric as demonstrated earlier. For all South Africa, what do we have? We have the heat maps presented for every district in the country across the 9 provinces. And as we mentioned, for the last 60 days. We can, of course, we can select a province. I think we saw Eastern Cape in the presentation. Let's look at KwaZulu-Natal for the demonstration. So what we can see here is that in KwaZulu-Natal, in some areas are still in control from the last 2 months, whereas others have passed the alert phase and moved on to the response with a high risk phase. Equally important is to see the districts for KwaZulu-Natal on a map, noting that the response, those districts in response here are from the southern and to central KwaZulu-Natal, with districts on the west being in an alert or medium risk phase, while we have districts in the north being in a control phase. Now, if you want to know exactly how to calculate these districts, we have here, click on this on the green button for more details, a description on how do we define the metric, how do we switch off an alert or response activation with a worked example with new cases, and how to calculate whether we're in a control, alert, or response phase. Likewise, we have the sustained increase monitoring tab next to case threshold metric, and here we have the definitions on each of these metrics, as well as the plots now for each of the districts. So we saw earlier in the presentation that KwaZulu-Natal as a province had just reached or exceeded the threshold for a second wave. We can see now that this is true also for Harigwala and Ugu districts in South KwaZulu-Natal, as well as Ilembe and eThekwini municipality. And interestingly, what we show for each province is something called unallocated. Now, these are cases that are currently being geocoded or unable to be geocoded or allocated to a district within the province. And so this is also something to be noted for each of the provinces in the country. If we go to hospital admissions, we are showing hospital admissions at provincial level only, so there isn't a location to select. What we can do is we can scroll and compare both daily admissions and current occupancy. We can see that both daily increases, both daily admissions and current occupancy are increasing quite sharply. in the province of KwaZulu-Natal. I'd also like to highlight that we have a contact page here with if you have any queries on the dashboard or the analysis that has been conducted. Let's get back to the welcome page just to present a few technical details. This dashboard is presenting a subset of metrics that's used to support planning in South Africa, and the public, of course, can access it and use it in order to assess risk, not just in a district where one is residing, but also in a district where one perhaps intends to travel in the next few weeks. And one can look at both the case risk as well as the capacity of or the take-up of hospital beds or use of hospital services at the provincial level. This dashboard, because we have a number of plots and detailed plots, is best viewed on a tablet or a computer. But if you are viewing it on a mobile device, which is of course possible, we suggest that you zoom in to look at the plots in more detail. The dashboard, if it is left idle for more than 10 minutes, so if I didn't click on any tabs or buttons in the next 10 minutes, it would time out in terms of not being used, and you would just need to refresh your browser in order to load it again. Now, it is very possible that in some areas of the country we would have low internet connectivity, but that does not mean that one cannot access the dashboard. If one can get to the landing page, you would not need to scroll through each of the tabs to access the information, but rather you can download a report which provides a daily snapshot of the data. And you can see the report has downloaded. I'll just show you one that I have open in the meanwhile. Here's a snapshot of the report. It's a PDF report saying when the report was downloaded, with the details that are on the landing page of the dashboard, an introduction with all the data and the necessary information on how the data was collected and how the data is being used. Important information on licensing, description of the metrics, and then we provide the metric overview. The case threshold metric overview for the whole country, as well as the map. And then we do this per province for each of the line plots, as well as, and we can scroll all the way to the bottom, I'll just do it here, for all of the 9 provinces. And we also show sustained increase monitoring plots here at the provincial level, as well as the hospital occupancy plots. And so this can be a daily report that can be downloaded if internet connectivity is poor. In terms of updating the dashboard, as we know, new data comes in every day. There's a process where the data needs to be geolocated and checked. So we will be updating the dashboard every 2 days. So basically it will be 3 times a week. We are aiming for a Monday, Wednesday, Friday schedule. But of course, this can change should new information become available, or should there be a sudden, let's say, a super spreader event that requires daily monitoring and so forth. Then we will change our updating schedule. But just to add that it is updated regularly, at least a couple of times a week, and you can see the date of the last update on the landing page. I'd now like to hand over to Dr. Harry Moultrie, who'll take us through some of the other details on accessing the app. Thank you.
Thank you so much, Dr. Sheetal Salal. Thank you, Gesina, for putting up the slides. So just really briefly, I want to provide some information on the licensing and sharing and how to share access to the dashboard. The SACMC Epidemic Explorer is licensed by Creative Commons under the BYND4 licensing. That it requires an attribution and no derivatives. So while absolutely free to share, copy and redistribute the material in any medium or format for any purpose, even commercially, we do request that it is done under the following terms of the license. First of all, that it's attributed, and by giving appropriate credit, provide a link to the license of Creative Commons, and need to indicate if any changes were made to the presentation or the graphs. And you may do so in a reasonable manner, in terms of the attribution. In terms of derivatives, we say no derivatives. So if you remix, transform, or build upon the material, you may not distribute the modified material. And that really is just to stop disinformation or the utilization of this app for misinformation or disinformation. Next slide. In how it can be shared, we are keen for people to share it as widely as possible. We believe it does have some value in providing district level data for the country. And so the link for the dashboard can be shared. If we provide an image on your websites, please embed a link within the image, which would lead to the website. And please add a source credit. There's an indication of how we would like it to be credited. And we also provide a preferred description of the dashboard, which is the SACMC Epidemic Explorer as a dashboard built by the South African COVID-19 Modeling Consortium to explore the COVID-19 epidemic in South Africa, analyzing resurgence risk, presenting metrics to prepare for future outbreaks, and monitoring COVID-19 hospital admissions. Lastly, there is an email address for any queries related to the dashboard or analysis. So please contact us at info@sacovid19mc.co.za. We're going to move forward to the questions and answers, but we really do encourage people to share and make it available.
All right. Thank you, Dr. Moultrie, Dr. Silal, and Dr. Cassin Meyer. Thank you so much for your time. I do have some questions from the media, but I'd also like to encourage those who haven't sent through their questions to do so. You can send through your questions on the chat, but also you can raise your hand and you can just pose your question to the experts here by first introducing yourself and the media house that you come from. So the question that I have here is from Carl Cohen from News 24. Carl has two questions. The first question is the case data utilized from date of reporting or date of sample collection or delivery? His second question is also, is it possible to make the underlying data available to the public, particularly the hospital admissions showing current occupancy? And is this only available by province or by facility?
Hi, thanks. You seem to be on your WhatsApp screen. So to answer Carl's first question, thank you, Carl, for the question. The data is reported by date of laboratory report or date of reporting, not by date of sample collection. The reason for this is that the geolocating, the scrubbing of the address data that we receive happens only once cases have been assigned case IDs, and then at that point the geoscrubbing activities happen within the NICD to allocate cases to province districts and even in other instances sub-districts and wards. Using the reported data also allows us to, if we use sample submission date or sample collection date, we would have to censor a lot of the data anyway because of some lags. We believe at the moment the laboratory lags are fairly stable, so we don't think this introduces any bias or issues with interpretability of the data. We believe it is interpretable and correct. With regards to a question about the DATCOV data and whether the hospitalization and DATCOV data is available, that is a discussion which we will take up with NICD colleagues and the other stakeholders. Already some data is available through the NICD dashboard where case data can be exported, I believe, but the hospitalization data is sent out on a daily basis at provincial level. We're currently not sharing that at a district level. I'll stop there.
All right. Okay, Dr. Meyer, would you like to add, or Dr. Silal?
I think Harry covered that.
Okay, all right. So the questions are coming in hot and fast. So I have a question from Elsa B. Brits. Elsa B. wants to know, is the second wave currently worse than the first? Yes, and do you expect it to become worse in the coming months?
Okay, I'll take that question, and then perhaps some of my colleagues can come in if they want to add. Currently, there are some areas in the country, small geographical locations, where we're seeing higher case numbers than we did during the first wave. What we need to remember is that the interpretability and the direct comparison between first and second waves is somewhat affected by access to testing volumes, and sort of questions around that. However, what we are seeing in some areas is that the hospitalizations are, for example, in the Western Cape and city of Cape Town, are as high or possibly even higher than during the first wave. So we are getting indications that in some areas we are seeing a substantial second wave. What we expect to be coming worse in the future, it's quite hard to project going forward. Data on seroprevalence at local levels, districts, sub-districts, even provincial, are not available. That makes it quite difficult to model where we think this is going to go. In terms of South Africa's, a lot of people sort of try to look at the experience of European countries to say, well, you know, our second wave is going to look like theirs. It's important to remember that our first wave resulted in substantial numbers of cases, infections, and therefore immunity in the population. So there's some uncertainty. We're not sure whether it's going to be as bad, worse, or less severe than the first wave. I also think there'll be considerable heterogeneity by area, by geographical space. I wonder if anybody else wants to add.
I think you covered it quite well. Thanks, Harry.
Okay. So we do have other questions. We have Shani Reddy from the Daily Maverick. She wants to know if you foresee turning this dashboard into a free-to-use mobile application to aid with further access of information.
Thanks, I'll take that. So the dashboard can currently be viewed on mobile devices, and it renders quite well on mobile devices, and it is of course free to use right now. And so I'd like to hear your feedback on that. The difficulty with the mobile, with viewing on mobile devices to begin with, is that we have a number of plots, and they're quite detailed. And so one can really only be looking at one plot at a time, and one would have to zoom in. We do not have any plans right now to make a formal application for individual download for the app. If this is, I think, as we monitor feedback in the coming days, we can see if this would be this would be a source of improvement, and if so, we can look into that. But they currently are not plans. It is just that the dashboard as itself can be viewed on a mobile device.
All right. Yeah. Okay. So Estelle Naika, I'm not sure which media group, she didn't say, but she would like to know, are there any tools being used to measure the rate of recurrence at the moment?
Thanks, Estelle, for the question. We're not doing that as part of the Epidemiological South African COVID Modeling Consortium. Reinfection, I presume you're talking about reinfection, where people get reinfected with COVID-19. There's a lot of local and international effort being undertaken to assess the potentials for reinfections. We have seen globally a small number of cases of confirmed reinfections, and there are some studies being undertaken at NICD and elsewhere which are looking at this further, but it's not part of the COVID Modeling Consortium. Obviously, this data has relevance, though, for us. And in order to understand the epidemic and to model it, issues about the potential for reinfection are clearly fundamentally important to parameterize the models. So we're watching the international literature. We're in consultation with local researchers, in discussion with them regarding what data is available and not yet published to assist us with parameterizing the models. Thank you.
Okay. So we do have a last question from Kyle Cohen, and he promises it's the last question. So Carl wants to know if you have an indication of when if you will be able to publish updated models with costing and cases and vaccine distribution.
I'll take that one. It's hard for us to make promises at the moment. We will start on the vaccine modeling. We've done quite a bit of vaccine modeling, and we're part of the MAC on vaccines, both the budget and cost modeling work stream, as well as the target population work stream. So what's important there is that we will model as those decisions need to be made. And as before, and I know this is extremely hard to accept on the other side, is, apologies for that, what's really important is that when decisions need to be made, we will have data ready to support them. We can't, however, promise that they will be fully in the eye of the public as soon as they get, as soon as we are done with the results. And that is because there's always a level of peer review. There's also a level of review within the rest of the structures of the MAC and the Department of Health. And in order to be able to make timely or influence decision in a timely manner, those outlets are the most important for us and the ones for us to prioritize. We will, however, as we have now, endeavor to make those data public, or those results public, as soon as we can. So I think that's unfortunately all we can say. I think for us, there's two main tasks going into the next year, and that is to basically estimate the size of the resurgence and additional waves and the distribution thereof, and then have that also inform our vaccine modeling, because of course it is gigantically important in terms of estimating the effectiveness of the vaccine, especially in different locales and for different populations, and then in turn inform the choice of target populations, etc. So we will be doing those two things at the same time.
If I can also just add to that, thanks, Kazina, just to add that we give a lot of thought and do a lot of research when deciding to put out model projections as to how robust those projections are. Are they representative of the current situation? What is the known data at the time? And the modeling of the second wave, how long it lasts, and how bad it would be. These are not just problems that we are grappling with in South Africa. In fact, it is a global phenomenon. We are part of a global community of modelers, and these are discussions that are happening worldwide. And many modeling groups have also refrained from trying to make statements on what a second wave is going to look like, for the simple reason that there are so many contributing factors that one needs to collect data and to be able to separate to identify the real causes behind second waves and so forth. And so that is also why we have not sent through any modeling projections at this time, but also to indicate that there's a considerable amount of discussion that will go forward with respect to the vaccine modeling and the costing when next we update our projections.
Thank you, Dr. Silal. Thank you very much. We have a follow-up question from Estelle Nanka from Caxton. She wants to know, in terms of the super spreader events, will these be given special consideration on the app, and will they be named and geographically located? I know, Dr. Silal, you touched on it, and I think Estelle just wants a little bit of substantiation from your side.
So the purpose is doing is slightly different. When it comes to the super spreader events, if these are data that are depicted on many of the provincial dashboards, and I'm not sure on the NICD dashboards and so forth, but the provincial dashboards do show them. We are showing our data and our projections on our classifications on risk at a district level. And so what we are not showing is what could be happening at a small level, perhaps at a ward level, or enumerator area level, or something like that. And those are perhaps better covered and better managed by the provincial dashboards and the provincial data sharing and the NICD. So we will not be showing small area super spreader events. However, as these lead to community-wide transmission and we start seeing their impact at a district level, we will be updating the dashboard, perhaps even on a daily basis, to show how things are changing as they happen.
Okay. All right. Thank you, Dr. Silal. I don't have any more questions, but I'd encourage colleagues who still have questions to email them to me. I will just put my email up on the chat box here. And I'd like to just thank colleagues from the media for availing their time, and our experts, Dr. Harry Moultrie, Professor Shital Silal, and Dr. Jacine Meyer for availing themselves as well for this press conference. Our media team will be in touch with the resources for media, including the presentation and the recording of this meeting, as well as the link to the dashboard for media to use as tools. So if there aren't any other pressing questions, I think we've come to the close of the press conference. Thank you very much, everyone.
Lesego, just our Twitter handle is currently being displayed here. We've just
as well. Okay, we'll also share that. We'll also put that as part of the pack that we'll send to media. But if there are any other questions in terms of how you reach the consortium, you can talk to me or other team members from the NICD, and we'll direct you to Dr. Silal, Harry, or Dr. Meyer as well. All right. Thank you very much, everyone.
Thank you all for attending, and please do and share, use the app if you see it has value. I think it does. Thank you so much.